By way of explanation, this is the last week to work bills. Thursday is the last week for us to do this, so we are very packed, and there's no point in hearing a bill if you're not going to work a bill. Sometimes we just have a hearing because of information. Working a bill is where we take final action, and so today we will begin by taking final action on 4 bills. So again, we need to take final action on bills each day. We have Tuesday, Wednesday, Thursday to hear bills and take final action on bills. But yesterday we ran out of time, and I don't want to run out of time today. I truly appreciate those that are here to testify on 315. We have 1, 2, 3, 4, 5, I think 17 folks. And if you could, I think I put the list out there somewhere for Dr. Perry. If you would be willing to give up your time, we would really appreciate it. Otherwise, each of you would get about 20 seconds to speak, and I don't think anybody wants that. And thank you.
Those are the ones up next.
So far, I have 1, 2, 3, 4, 5, 6 people that are going to testify. Have the other folks that you spoken to, have they relented their time? Debbie? Thank you so much. And I'm sorry, I couldn't hear. Okay.
This is Dr. Earl. I could relent my time to Dr. Perry.
Thank you. Debbie Detmer? Yes. Hi, Linda. Oh my goodness. I had her little boy when he was in, what, 4th grade? He's probably 40 now when I taught school. Thank you. All right, so Debbie Detmer? Is Debbie in the room? Thank you. So the ones that will be speaking, I have Dr. Galen Perry, Dr. Lauren Schiffman, private citizen, Glenn Berdue, Karen Andrus, and
Catherine.
I'm sorry.
Catherine Andrews.
Okay, Catherine Andrus. Okay, do we have any others who are willing to give up their time? We want Dr. Earl to speak. Thank you. Thank you, Glenn. So that gives us 1, 2, 3. What about Olivia Lyon, Karen Hershey? Okay. And Karen Hershey, are you in the room? Would you be willing to give up your time? I'm sorry. Okay, I have Galen Perry, Lauren Shipman, Jeffrey Earl, Olivia Lyon, Karen Hershey. That's 1, 2, 3, 4, 5. Because we also have opponent oral. So
What about Catherine? Catherine Andrews?
is she here? Yeah, I'm here. Would you be willing to relinquish your time? Right. Pam McDermott? Yes. Okay, yes. Would you be willing to relinquish your time? Okay. Again, it's just going to reduce the amount of time each person has to speak. Carol, are you present? Okay. Would you relinquish your time? Kathy Brown. Are you in the room? Yes.
This is Dr. Earl. I'm willing to
Yes.
relinquish my time to Dr. Perry. I don't know if you heard that.
I'm sorry. Okay, Dr. Earl, it seems the consensus of the room is that they would like for you to speak rather than Dr. Perry. No. All right. Then I'm afraid we have 1, 2, 3, 4, 5, 6, 7, 8, 9, I'm counting. 9?
9 without Dr. Earl.
6. All right. I'm afraid then each of the speakers will have 1 minute, and that includes our oral. Again, we have 3 bills that we will be hearing today, and we will be working 5. We're going to begin with Senate Bill, I'm sorry. Okay. Okay, thank you. We are going to begin with the committee or the bill that we were unable to hear yesterday, 2288. They promised me they'll take 30 seconds. We're going to open the hearing on 2288. If you could please, our first speakers are, we will start with the reviser, Jenna Moyer.
Saving a little time by jogging up to the podium. All right, good morning, committee. Thank you, Madam Chair. House Bill 2288 would enact the Behavioral Sciences would enact the Counseling Compact to provide interstate practice privileges for professional counselors. And this passed the House by a vote of 121 to 0, and this would allow states to issue licenses for individuals wishing to pursue that as individuals wishing to pursue a professional counseling membership in the compact. And if you've seen compacts before, this has a lot of the same provisions. It would establish a board that would have rights to establish regulations for discipline and other matters that come before the committee. Section 2 has definitions. Section 3 goes over conditions for states to participate in the compact. And those would include things like a membership to the compact, paying fees, that these licensing requirements, as well as duties of the membership states. And for an individual to participate in the compact and have the privilege to practice in other compact states, they would have to participate in the rules, not have any encumbrances or restrictions against their license in the past 2 years, notify the commission that they want to seek practice privileges, pay fees, and meet continuing education requirements. A licensee that is practicing in a remote state, which is a member state other than the individual's home state, where you're exercising or seeking to exercise practice privileges, would be required to follow that state's regulatory authority, and that state could discipline such individuals. And Section 4 goes over the privilege to practice for individuals. They would have to have a license in the home state, have a social security number or national practice identifier, be eligible for practice privileges and other requirements. And a home state would be defined as a member state that is the licensee's primary state of residence. And this compact is active. The rules of the compact state that it would go into effect upon this 10th state, and that threshold was passed in May of 2022 when Nebraska joined the compact. Section 6 goes over military personnel and active duty personnel privilege practices. Section 7 is the states that the compact shall recognize rights to practice Telehealth, Section 8 goes over adverse actions, including remote state discipline. Section 9 is that commission that I talked about and goes over the things that the commission can do, the board's rights. Section 10 is the data system to keep things confidential. Section 11 goes over the rulemaking authority and the areas that rules could be adoptive. Section 12 of the compact goes over oversight, dispute, resolution, and enforcement. And Section 13 goes over that date of implementation, which would have gone into implementation in May of 2022. There were House Committee amendments, and that was mainly that the board could set a fee of $25 for counseling compact privilege, which mirrors other fees for similar compacts. I'll be happy to answer questions.
Committee, any questions for Jenna? Senator Petty.
Thank you, Madam Chair. So Jenna, so you mentioned that Nebraska, I think, was the last to make it 10. So this compact is already in place. So we would be joining on. They already have their main board. We would then have a seat or seats on that board, but they've already put in place or begun putting in place those oversight regulations that the boards would provide over and above the
I'm not sure all the rules that have been in place. Hopefully proponents could talk about that. But yes, the board would already be in place and we'd be joining an active compact.
Thank you.
Thank you, Jenna. We have 3 people here, and 30 seconds was, I told you, David, we can't have all 3. Who did you designate to come up? Okay. Andrew Secor. Thank you for waiting another day. 30 seconds is not a very long time.
Not. I've been working on paring this down. Time myself. All right, Madam Chair, members of the committee, thank you for your time this morning. Kansas Council, I'm Dr. Andrew Secor, President of the Professional Counseling Association in Kansas, and we are proponents of HB 2288. It enhances public safety, improves access to mental health services, supports relocating military spouses. There's 20 states have already enacted the compact, including Colorado, Nebraska, Arkansas, and Wyoming. 20 are pending. The legislation has broad support from our counseling training programs and has national support as well. There's a strong desire to see this active. It keeps Kansas on par with the current trend and joining other member states, as well as preventing restriction to access to care and also improving mobility for our practice professionals. Thank you.
Quick questions for Dr. Secor.
I can speak to Senator Petty's if there was a question.
Thank you. If you could address that now that the compact is already in place or it was in place, put in place with the 10 states joining.
Sure, thank you. So the Compact Commission is currently meeting. They had started meeting last fall and each state has a delegate that is representative of that state that is able to serve in making decisions. The decision making has not been final yet. They plan for that compact to be ready to go in here in 2024 at the beginning of the year. And so, but they are actively meeting and working that. So we would have that seat should Kansas enact the compact.
Have any other states, besides since the last session and with Nebraska, have any other states now passed this compact?
Yes, so Arkansas just recently joined. We have Wyoming that has recently joined. Virginia has joined. So there are also 20 other states pending. Missouri is pending, Oklahoma is pending, Iowa is pending. So there are several states in our region.
And thank you, and we do have all of your written testimony, and I have read that, and it does have the states in there. Thank you so much. And this closes the hearing on 2288. And again, for those in the room, the committee, and those on WebEx, I could have said, we don't have time to hear these bills. We don't have time to work these bills. So if you feel rushed, I apologize. But before we work the bill, we always read the written testimony that you sent in so that we're prepared when it's time to read the bill. We are now going to, committee, we're going to open up final action on Senate Bill 287. This is the bill that we heard yesterday regarding the silver alert. And do you need a quick refresher from Jenna?
Thanks, Madam Chair. Senate Bill 287 would expand the silver alert to include vulnerable persons, which would include people who are over 18 that have dementia, developmental disabilities, such as autism spectrum disorder or a cognitive impairment.
Thank you, committee. I do have an amendment This was, as you remember, brought in as a definition. It seemed to be agreeable to the other proponents of this bill, and it just changes a vulnerable person to or a missing person who is 18 years of age or older and has dementia, developmental disability such as autism spectrum disorder, or a cognitive impairment. And it does strike that definition of a vulnerable person that won't be needed when we put in this intersection. Committee, I will move this amendment. Do we have a second? Second from Senator Erickson. All in favor of this amendment? Yes, Senator Baumgartner.
So have we heard from anyone, do we believe that this would allay the concerns of someone that perhaps might be on the spectrum, might have a cognitive disorder from an abuser
Yes.
identifying them and having them return?
Yes, we heard that yesterday. I think her name was Stephanie that testified and did speak with her, law enforcement, and about how that would work and that there's much more to it than just an immediate silver alert.
Thank you, Madam Chair.
Yes. Any other questions about the amendment? All right, I move, we have a motion and a second. All in favor of this amendment be to 287, please say aye. Aye. Opposed? Hearing none, that amendment has been passed, and now we're back on the bill. Do we have any other amendments or any discussion? All in favor of 280, yes, a motion, thank you, for amending 287. Senator Baumgartner?
Madam Chair, I move we pass out Senate Bill 287 as amended favorably.
Second. Senator Erickson, all in favor say aye. Aye. Opposed? 287 as amended has been passed. Committee, let me next direct your attention to Senate Bill 297. You may recall Senate Bill 297, and Jenna, could you give a brief overview about that definition?
Thanks, Madam Chair. Senate Bill 297 would standardize the definitions of abortion and also specify that ectopic pregnancies and birth control are not considered an abortion.
Committee, do we have any discussion of this? All right, any amendments? All in favor of Senate Bill Senate Bill 297, we need a motion.
Madam Chair, I move that we pass out Senate Bill 297 favorably for passage.
Second, Senator Baumgartner. All in favor say aye. Aye. Opposed?
No.
Your ayes have it. Senate Bill 297 has been passed out of committee. Senate, committee, I would next direct your attention to Senate Bill 2340. Oh, excuse me, 2264. I do have an amendment to that. And you may recall that we talked about they have worked on this bill, and over on the House side, they softened it from shall to may, and they softened it from requiring to authorizing. And Jenna, would you just give us a quick refresher on 2264?
Thank you, Madam Chair. Senate Bill 2264 would enact the No Patient Left Alone Act. It would require hospitals and patient care facilities to not prevent individuals from receiving visitors and would allow patient care facilities to adopt policies and procedures, allowing in-person visitation in certain circumstances when the patient does not object, and would allow a patient care facility to adopt more stringent policies as necessary for critical care units or a patient's health. And the House also added language to allow patient care facilities to follow a federal regulation so that they would not lose their federal funding.
Thank you, Jenna. All this does on the amendment is change it back to the original intent. Authorizing and may does not give. I mean, they may do it now. This just says they shall and requires. Do we have a second on this amendment? Okay, so it's been moved and seconded by Senator Erickson. Do we have any? Yes, Senator Petty.
Thank you, Madam Chair. I see on this, sorry, there's background conversation going on the amendment that's been offered. This appears to be in conflict with testimony that was provided concerning adhering to federal laws, rules, and guidance in order to require eligible for federal funds and programs. So I'm concerned about the jeopardizing federal funds, which are absolute necessity for our nursing homes.
And Jenna, if you would correct me, I believe that this is addressed in another part of the bill, is it not?
Thank you, Madam Chair. This only changes the may to shall, and I believe the only testimony about that was that it may be difficult for, not nursing homes, but private assisted living facilities to have time to adopt these policies, but it does not require a facility to contravene federal law to adopt the policies.
But doesn't it also have in the enacting clause changing back authorizing to requiring?
It would require, thank you, Madam Chair, it would require the facilities to adopt visitation policies and procedures.
However, it does have the provision that, and it's not on this particular amendment because it's not part of it, but I recall when you and I discussed this earlier that they are subject to and not prevent them from getting their funding. I recall it saying not subject to G, subsection G.
Sorry, I didn't know that was a question. Can you restate it? Sorry, I was looking through the bill.
Yes, later in the bill, it says something about not foregoing subsection G regarding, correct, and that's still in there.
Yes, so this would say, regardless of the visitation policies that are adopted in subsection G, a patient care facility could still require a visitor to adopt infection control facilities.
And then it goes on to say,
Procedures.
yes, all right, thank you. Let's vote on this committee. So I move the amendment for 2264, and do we have a second? I think we had a second from Senator Erickson. All in favor of the amendment, please say aye. Aye. Opposed? No. The ayes have it. So this 2264 as amended, now we're back on the bill. And do I have a motion then to pass this as amended? I'm sorry, Senator O'Shea.
I have an amendment.
Okay, so
And I apologize, she did email me about it, but I did not get it on my list for today, but I would be happy to explain the conceptual amendment if the chair would.
okay, yes.
To that. Okay, so what the senator asked me to do, and I'm very sorry about that, it would say that any loss of federal funds based upon compliance with the bill would be backfilled by state general funds up to $1 billion. So if the compliance with House Bill 2264 would require a facility to be in violation of federal law that resulted in loss of funds, that the state would have to reimburse the facility for such losses.
Do I have, or would you like to move your amendment?
Yes.
Do we have a second on the amendment? It's been seconded by Senator Holscher. Committee, all in favor of this amendment, please say. More discussion?
Well, we haven't had discussion.
Oh, okay, discussion?
Yes, Madam Chair.
Yes, Senator Petty.
I'm sorry, there hadn't been any discussion. We just had an explanation of the conceptual. So my question about this amendment would be, as Jenna had mentioned earlier, on page 3 of the bill where it says, nothing in this section shall be construed to supersede any federal law, rules, regulations, or guidance regarding patient care facilities. So my question would be, does this does this amendment just add more teeth to that? Or does this already speak to that, that issue about losing federal funds? I'll ask the maker of the motion.
Thank you. I would refer to Jenna.
Thank you, Madam Chair. This would be in addition to the protections in subsection K.
So Jenna, so this is in addition to, but I guess my question is, does this line 18 on page 3, already cover that?
It would just be an additional option.
Or
So
option
subsection
or
K
safeguard?
should cover it, but if something came up and the facility ended up being out of compliance.
So does this proposed amendment, does this come, where in the bill? Would it come in this section, that same section, notwithstanding subsection G? Would it come also here?
I would add it as a new subsection L. Saying if any of the provisions of this bill result in a facility's noncompliance with federal law that results in loss of funds.
Okay, thank you.
Senator Thompson.
Yeah, Madam Chair, I would really like to see the language on this. I feel very uncomfortable voting on this, and I would make a substitute motion to table this amendment.
We need a second on the substitute motion. We have a second from Senator Steffen. All in favor, say aye.
Discussion. Point of order, discussion.
Discussion?
I find that very hypocritical considering what happened yesterday.
Okay, that's not discussion of this
It is
bill.
discussion.
It is not. We need to stay on this bill,
So I have a line
this amendment.
that a reviser missed.
Question.
My question is on the amendment itself. Per the reviser, it sounds like there are some protections in the bill. So my thought is, if we are confident of the protections already in the bill, it shouldn't be an issue to vote yes for this amendment because it's a backup.
Senator Erickson.
Thank you, Madam Chair. My concern with this amendment is, yes, the bill does say nothing supersedes federal law. So a facility could violate federal law and put the state on the hook for it against the provisions of this bill. And so I'm just not willing to open up $1 billion can of worms for a rogue facility to break federal law and then the state's on the hook. So without further examining this or tabling this so I can look at the language, I will not be supporting this amendment.
All right, Senator Blasey.
Thank you, Madam Chair. May I just make a recommendation that maybe we just move on from working this bill for now, because there's clearly a lot of questions and conversations. We have the largest committee meeting of the year here. We have a lot of people who've traveled from every corner of the state, and we have 29 minutes left in this committee. I think it's important that we hear about the policies before us. Thank you.
All in favor of tabling this bill? No. I'm sorry.
Substitute motion.
Okay, we do have a substitute motion. All right. All in favor of the substitute motion from Senator Thompson, say aye. Aye. Opposed? No. The ayes have it. So we will be tabling that amendment. And do we have any other amendments?
I'll make a motion that we, I don't want to say table, because we'll have to bring it back up from the table. I think we just postpone the bill until another date. Thank you.
Second.
It's been moved and seconded that we postpone working this bill for another day. All in favor say aye. Aye. Opposed? Committee, I will finally turn your attention to the last bill, which is 2263, authorizing pharmacy technicians to administer certain vaccines. Do we need a refresher from Jenna? No? All right. Do I hear a motion on 2263?
I move we pass 2263 favorably for passage.
A second? We have a second from Senator Petty. All in favor say aye. Aye. Opposed? House Bill 2263 has passed the committee. I'm sorry, Senator Stephan. Okay. Would you like to pass out your amendment? Hmm. Mm-hmm.
Madam Chair, yes, my friend Senator Stephan did have his hand up. However, I'm curious what happens now because we did actually take action and pass the bill.
We did, and yes, he had his hand up, and I did miss the amendment and didn't ask for amendments, and you are correct. So I
don't know that we can go.
do we have a copy of the amendment, Senator Stephan? Oh, it's the two, it's just adding in those two bills. All right. We can see if there is a second on that amendment. Do we have it second? Senator Thompson, we will vote on that amendment.
We'll have discussion on that amendment.
Let's have discussion on the amendment.
Okay, first of all, we need to know what the amendments are. He mentioned two bills. We need to go over what those two bills are, or we need to put this off into another day.
Madam Chair, I think since the bill is passed out of committee, we'd have to reconsider the bill and then add the amendment. That's what we want to do. However, I think, again, due to my earlier comments, I think we need to move forward. Appreciate it.
Senator Stephan, I agree. We have people who have come in from out of town, so we will postpone this bill, 2263, to allow time to discuss your amendment. We will do that tomorrow. Thank you for patiently waiting. You can see the work that we do here on committee. We appreciate your being here very much. And again, we are going to start with our agenda. We have Senate Bill 315. Again, we were only going to give 30 seconds for each person to, 1 minute for each person to speak. I'm not sure we have that amount of time now. Is there anyone else that's a proponent or an oral opponent who is willing to? We do have your written testimony. Okay. Yes, ma'am. Thank you, Karen. Oh, there's so much to say. We understand. Appreciate everybody being here. Then we do have 1 minute, and we will begin with Dr. Perry. Oh, yes, we do need an overview from the chair, or from Jenna.
Thank you, Madam Chair. Senate Bill 315 amends 3 statutes of law and repeals an additional section. Section 1 would amend KSA 44663. You may remember you passed in special session 2021 legislation that required an employer who had a COVID-19 vaccination requirement to accept a religious exemption to such vaccine requirement, and this bill would expand that from COVID-19 to any vaccine, and would also expand the definition of employee to include a student who is completing coursework that involves patient interaction and delivering care at a healthcare facility under the supervision of another individual. So this would be like a nursing student who is completing their clinical rotations would be included as an employee who would be allowed to claim a religious exemption, and that to be granted by an employer without the employer being able to question such religious exemption. This would also amend the section of law, KSA 65508, that requires childcare or maternity centers to obtain vaccination records from children attending those facilities. And this would put in those same religious exemptions for individuals whose children are attending such facilities. This would also amend KSA 7262, and that is requiring vaccinations for children attending school, and this would put in that same language allowing a written statement by at least one parent stating that the requirement would violate sincerely held religious beliefs of the child, and the school board would, or in the school would be required to accept that religious exemption for those students' vaccination exemptions.
So Jen, if I understand correctly, there is already a language that the employer must accept a religious exemption
Yes.
currently, and this just extends that exemption for children in schools, daycare, et cetera, that they need to accept the religious exemption.
Yes, and this would also appeal KSA 76761A, which requires colleges to adopt policies requiring a meningitis vaccine for students living in on-campus housing. So that requirement would be
And so
repealed.
colleges can still do that, it's just no longer it would no longer be a state requirement, just colleges may require.
It would not be required, correct?
Thank you. Committee, any questions of Jenna? Yes, Senator O'Shea.
Thank you, Madam Chair. Jenna, this is Senator Steffen's bill. Senator Steffen's bill also had Senate Bill 20. How is this one different than Senate Bill 20?
Yes, this is different from Senate Bill 20 in that there is no mandatory fee. There would have been in Senate Bill 20 a $25,000 civil fine associated with a childcare facility or school that questioned a person's religious exemption. And additionally, I believe that we took out the definition of COVID-19 vaccination requirement. Or excuse me, vaccination requirement.
Senator Thompson.
Thank you, Madam Chair. Thank you, Jenna. One real quick question regarding the bottom of section 1 and number 7 there. I just want to make sure that this still covers COVID vaccines by the definition, because it says vaccine means an immunization, vaccination, injection, or series thereof administered to stimulate immunity. Would that definition, and perhaps Dr. Steffen could answer that better than I, but I just want to make sure that covers the COVID vaccines.
This should cover any vaccination. That's the typical definition that we use for vaccine. If you'll look to the crossed out definition of COVID-19 vaccination, it's identical to that with the words COVID-19 taken out.
Dr. Steffen, do you have a question or a comment?
Yes, thank you. Now, this bill does bring uniformity of the exemption language that was created in the special session for adults, employers, employees, brings it to our school-age kids, right?
Schools as well as daycare facilities.
Right. Yes, Senator Blasey.
I'm not a doctor, thank goodness, but I do respect doctors. Thank you, Madam Chair. My question's piggybacking off Senator Gossage's question. This bill is not only children, it's also affecting all adults and employers that require any vaccination, correct? It's not just relating to children, it's all persons.
So it would,
Employer requires.
it would expand the employer, that is required to give exemptions to vaccines. So if an employer required a flu vaccine or an employer sending people out on missionary work required a malaria vaccine, anything like that, they would not be required, or they would not be allowed to enforce that if a religious exemption were sought by an employee.
Thank you, Jenna. Senator Petty.
Thank you. So Jenna, that additional language about a student attending a public or a non-public high school, so that now that, why would that specifically be added to this bill? Was there a gap in who was covered by?
So this would cover college students as well as the students attending public or non-public high school. It was language that I was asked to add, that particular phrase, so that might be a good question for the original creator of the bill.
Oh, okay. All right, could the maker of the bill answer that question, please?
Senator Steffen.
Well, I am not the one who introduced SB 315.
Right. But I will, I think we can address it in that it was, there were some, the category says intern, employee, there are a lot of different definitions there. And what seemed to be left out was young people who were in college and they were not technically an intern, they weren't really an employee, but may be required to have a certain vaccine or something to work in a facility.
Thank you, Madam Chair. This would also cover a situation where a vaccine is not required by a school for attendance, a high school or a college, but would be required at a facility at which such student is working at. So if your school doesn't require a flu vaccine, but the hospital that you are interning at requires a vaccine, you would be allowed to then obtain that religious exemption.
So then that would mean if any student that would go to, I think you actually referenced this also about on a work trip out of the country. So any student that's going anywhere and working for anybody, although this is specific to work,
Yeah, it's specific to a healthcare facility.
to health, they would not, even if the healthcare facility had that in place for their employees, this would say that they would have this
The students as well
broad
as the employees,
definition for religion.
Yeah.
Okay, thank you. They would be exempt.
if they requested the religious exemption, yes.
All right, committee, Senator Holscher.
Thank you, Madam Chair. I just need clarification there. So hospitals can't require vaccinations for their employees under this bill, even if they're with very vulnerable patients. They have to do the religious exemption, is what you're
They
saying.
can require it, but would be required to grant an exception. If we look to employment law, there would be allowed reasonable accommodations to accommodate that. So you may be, if you worked in the ICU, you may be transferred to another unit, whatever would be considered a reasonable accommodation under employment law.
So they'd be required to grant.
Yes, they would be required to grant the accommodation.
Senator Baumgardner.
Thank you, Madam Chair. There is nothing in this bill that would require healthcare organizations to maintain their agreements with educational institutions. So if we're talking about nursing students, it would be possible with this legislation that different hospitals could say, okay, if you're not going to require that, we will not continue to have opportunities for the students to be in
Correct.
a work experience.
Thank you, Madam Chair. A hospital would be allowed to discontinue their association with a college or university if their students were requested these exemptions.
Thank you. Thank you, Madam Chair.
Thank you so much, Jenna. Senator Steffen.
Last comment, if a hospital or a clinic was to do that, they would have no more nurses or radiology technologists coming to their facility either. Their ability to employ those people would end.
Committee, we have people that have come a long way, and we're going to go, we must vacate this room at 9:30. Yes, ma'am. And what was your name? Thank you, Pam. Dr. Perry.
My son, Andrew Perry, was kicked out of a nursing program after 3 semesters before he was supposed to graduate, after he was denied both his religious and medical exemption for his COVID-19 vaccine. I'll ask all of you as parents, should my healthy 22-year-old son, who had already had COVID, be asked to take a vaccine that would give him no benefit or only potential harm, considering that he was in the highest risk group for myocarditis? We brought him home from that Iowa Christian school to take advantage of the Kansas special session religious exemption law, only to find out by the AG office that it did not cover my son as a college student. We also did a lot of investigating with Kansas nursing school exemption policies. There are schools who do not even put a policy in place to provide religious exemptions or medical exemptions for their nursing students, and I have tons of information about that. My son now has moved to Florida to finish his 6 years, a nursing degree that only takes 4. At least he has his health, and he knows what the foundation of medical ethics is. Right of conscience, bodily autonomy, and medical freedom. That's what this bill's for.
Thank you so much for staying within your 1 minute. I appreciate your enthusiasm, but that's not allowed in committee. But thank you anyway. Lauren Schiffman.
Thank you, Chairwoman, committee members. Just in the event that Olivia doesn't get a chance to speak, I just want to make sure that it's stated that she had to go to 3 different daycare facilities before she could find child care for her children. That's absolutely unacceptable. Her and her husband almost lost her job. Her husband was a healthcare worker, but I hope she can speak today because I'm in a similar situation. I'm here fighting for my boys because I was the one on the chopping block a couple of years ago. I actually lost my job. My boys watched me in torment, deciding whether I was going to give up a 21-year career in healthcare over my faith. This was the scariest and darkest time of my life. They watched me under duress, frantically jump through hoops, spend hours perfecting a document defining my faith to a complete stranger in the Human Resources Department to judge and affirm my belief from which he didn't even know me, and he eventually did reject it. because you all passed that bill in 2021, I actually retained my job and I still have it today. As you can see, I'm still in scrubs. So I don't want my children to have to go through that. So please, I speak to the Republicans in this room, especially one over here. Please follow your party.
Well, let's not do that. Let's not do that. No clapping, please. So now I'm going to move to Jeffrey Earl on WebEx.
Excuse me, point of order. I don't feel comfortable right now.
We will move to the next testimony. We have Jeffrey Earl on on WebEx.
Thank you, Madam Chair.
Excuse me,
I'm
point
here
of order.
from-
I would like there to be security in here.
I'm sorry, we just don't have time for that, Senator.
They're outside the door.
There's some outside the door. If you'd like to have them in the room,
Yes, please.
would you invite them in the room? Okay, Jeffrey Earl, please.
Thank you. I'm a family physician in Overland Park and have been for 30 years. I have a personal experience of difficulty with getting a vaccine exemption passed with an endoscopy center that I applied for privileges for. And so I ultimately was able to get the vaccine exemption accomplished. However, the difficulty that I experienced should not have happened. A religious vaccine exemption is an expression of freedom that falls under Title VII, the Civil Rights Act of 1964, and is protected by federal law. A person with a sincere religious belief that prohibits them from receiving a vaccine is entitled to Title VII protection, even if their religious belief is considered unacceptable, illogical, inconsistent, or incomprehensible to others, according to Supreme Court ruling. Law requires that employer assume an employee's request for religious accommodation is based on a sincerely held religious belief, regardless of previous religious inconsistency. These protections are not being consistently observed. We need to reinforce the language of Kansas statutes with clarity so that citizens can rely on the safety afforded by the law. Thank you.
Thank you so much. And now we have Olivia Lyon.
Hello, Chairwoman and committee members. My name is Olivia. We have 3 children, and I'm reaching out to ask for support for this bill. In a few months span in 2022, we were denied entry for childcare not once, not twice, but 3 times because of our sincerely held religious beliefs. Our faith was defined during this time, both at risk of losing our job, but our God has brought me here to speak out, to help with the voice of change, to help others as they may be struggling in similar situations. As a parent, it's our job to instill morals and beliefs into our children until they're at an age to explore this world on their own. Our rights to religion should be just that, our right to practice our religious beliefs. Our children should not be excluded in this, nor should they have to choose between their faith, schools, jobs, or daycare restrictions for their future kids. Thank you.
Thank you. Catherine Andrus.
Thank you. My daughter's due to graduate high school next year, and she's college bound. I don't want her to be in a position where she has to choose between getting a vaccine or going to college. Likewise, she's also on a track to become a CNA when she graduates, and she may become a nurse. Once again, is she going to have to choose between the career that she wants or a vaccine? As Senator Steffens said, if this bill isn't passed, we may not have nurses, and we all need them. Likewise, I'm a teacher, and I don't want to have to choose one day between getting a vaccine or keeping my job. I think this bill is super important because we're in the process of having our whole medical system being hijacked by pharmaceutical companies with their interests. And if we want to avoid that, I think this bill will help us do that. It would also protect the families that need protecting. And I'm assuming all of you probably went to college, and we never had to face these issues when we went to college. We had a great time. We didn't have to think about, should I get a vaccine or not? The kids today don't need to deal with that either. They should be able to have their 4 years of college and go on to a career like we all did with the freedoms that we had. So thank you.
Thank you. Carol Donis.
Good morning. Thank
Thank you so much. All right, so I'm going to have to be really quick. Last July, a Rand Corporation study commissioned and founded by DHHS was published proclaiming vaccines are very safe. What was not made clear to the public is that the study was designed in a peer review by high-level CDC officials, themselves including the CDC's Director of Immunization Safety. Barbara Lowe Fisher, who is the co-founder of National Vaccine Information Center, states, if the state can tag, track you, and force citizens against their will to be injected with
Carol,
biologicals of known and unknown.
I'm so sorry. Thank you
toxicity
so
to them.
much for your testimony. That was your mistake. You have 20.
Okay. Anyway, it's a conflict of interest of DHHS to be in charge of vaccine safety, license vaccines, and take money from drug companies to fast-track vaccines and partner with drug companies to develop and share profits. I mean, think about all this. You have all the literature there. I'm not going to skip to it. So vaccines should be an individual choice and never a requirement in order to receive medical services, attend daycare, or public school. Now, this bill does not in the least prevent anyone from getting a vaccine. It simply doesn't force them on our children. Parents should be making the decisions, not government.
Thank you,
The other thing I
Carol.
wanted to bring to your attention is that
I'm
if
so
the
sorry,
Kansas state officials
Carol.
state that they have concerns about measles outbreak,
Carol, please honor the timeline.
vaccines don't work.
Thank you so much. And Kathy Brown, are you here? All right.
Good morning. I am in support of Senate Bill 315. I was a nurse for many years, and then I became a lawyer. However, that's not the reason that I am for SB 315. I'm for SB 315 because I'm an American. I'm an American citizen. And our particular system of government says we choose. We don't submit to our governance. We consent to it. So nobody should be forced to have a vaccine. And also, I have to mention, the only reason we're having this level of controversy is because we've watched the nightmare of COVID. We've watched people be forced. Nobody should be forced to get anything like this. An injection is an invasive medical procedure. And if we have such a forcing of individuals to submit to this, we have a lot in common with China and Russia. So this needs to get passed. I'm very glad that the language has been strengthened. But the last thing I want to say is this. The very idea that we're in a position where we have to have recourse to a religious exemption already shows what a very bad place we're in.
Thank you.
It's sufficient for an individual who has attained majority, and again, American citizens, to
Kathy,
say,
thank
I
you
choose
very
no.
much.
I choose no. And we should be allowed to clap. I like to do First Amendment, and that's a First
I
Amendment.
understand that. It just, again, takes up time, and
We need
that's
more
why it's not
time,
allowed
too.
into committee. And you know what? If I had more time, I could give you more time. We must vacate this room at 9:30. No, we actually don't. All right, and now we'll go to opponent testimony, and we'll begin with Dina Hubbard. Dina, are you here? Oh, she's on WebEx.
Yes.
Dina, are you with us?
Yes, I'm on WebEx.
All right, Dina, you have 1 minute. You probably heard how tight we are on time.
Yes. I'm Dr. Dina Hubbard. I'm here on behalf of the Kansas chapter of the American Academy of Pediatrics. I would just like to point out that the far majority of physicians and nurses and healthcare workers do believe the science that vaccines are safe, they are effective, and they save lives. So I think it's a very small minority. What you're trading in terms of that individual freedom is the health and well-being of others, including our vulnerable patients. 95% of Kansas voters believe wellness vaccines are a good thing, and 67% of Kansas reject the idea we should add more wellness vaccine exemptions. Religious exemptions are already covered, so this is just making it less rigorous, and the majority of Kansans want more restrictions on that to keep each other safe. Love your neighbor, protect your neighbor. This is about more than just us as individuals. It's for the greater good. Thank you.
Eric Stafford.
Thank you, Madam Chair and members of the committee. Good morning. Really two main points to focus on today. I think if a lot of what's being said seems to be focusing around the COVID vaccine, and we need to be clear that this is talking about any vaccine. So if I have employees that are going to go to Mexico or Africa or Congo, wherever, and I'm asking them to get vaccines and get vaccinated for certain illnesses, and they already have religious exemptions anyway under the federal law, okay? So if we want this bill to pass, I would ask that we give employers liability protections for any injuries suffered if they go overseas for work, because we're doing what we can to try to protect our employees. This isn't about, I think we're confusing COVID with all other illnesses and everything that's in place. If we want to focus on COVID, and I also want to make a point too, that it was said at the beginning, we already have religious exemptions in place, right, for employers in state law. That is specific to COVID. That is not for any vaccine. That is under federal law. So I just want to make this clear that we have to be consistent in our arguments.
Eric.
Yep, thank you.
And Giovanni?
Giovanni Gone. I am the Executive Director of Immunize Kansas Coalition. Vaccine requirements are determined based on scientific recommendations for immunizations. These requirements keep children and adolescents safe by ensuring they are protected. Expanding exemptions is the first step in unraveling the critical work that has nearly eradicated diseases like polio, hepatitis, measles, mumps, and rubiola. 2 vaccines are responsible for saving millions each year, the Tdap and the MMR. Reasonable estimates range about 5 million lives saved every year. Employers have the right to protect their employees and customers and establish employee qualifications, which can include health and safety standards. Consider the implications of preventing employers in sectors such as agriculture, septic service, laboratory, food service, and hospitality.
Thank you so much. And we have 3 last opponent testimonies, and you can see the time. Is there someone who has something that they would like to say that has not already been said? I will start with Rhonda. Okay, Rhonda's next. Rhonda, is there something you would like to say that has not already been said? Presented by Paula Bundy. I apologize. Okay.
Paula Bundy. I'm presenting on behalf of the Kansas School Nurses Organization. School nurses are in our schools every day to help protect children, to keep them safe and healthy and learning in the classroom. We have many more vulnerable students who are medically fragile in our schools all the time. Loosening vaccine requirements impacts those children who cannot get vaccinations because of medical concerns or whose are interrupted because they are undergoing treatments. That puts them at risk and allows them not to be able to be safe at school.
Thank you. Rabbi?
Rabbi Moti Reber, Kansas Interfaith Action. I just want to say that the denominations that make up Kansas Interfaith Action hold very strongly that vaccinations are permissible, that there is no such thing as a religious exemption under the Lutheran heritage or Episcopal heritage or Catholic heritage. I'll just read one quote. There is no evident basis for religious exemption. On the contrary, both Lutheran heritage and ELCA social teachings urge participation in public health efforts because health is a shared endeavor. In the past, when somebody had to claim a religious exemption, they had to prove that they belonged to a denomination that had a religious exemption, such as Christian Science. This would take that out. The claim of religious exemption is not a get out of social responsibility free card. This is not a legitimate, most religious exemptions are not legitimate and they should not be put into law. Thank you.
Thank you. And finally, Blake?
Thank you, Chair. Blake Flanders, President and CEO of the Board of Regents. The portion of SB 315 we would like to speak to is the repealing of 76-761A, the meningitis vaccine requirement to live in student housing. This vaccine is an important measure to help prevent an outbreak of meningitis for students living in close quarters. We request that this portion of the bill not be repealed.
And it could still be required of colleges, though, however, correct?
So that would be in question. We've only had 2 business days to really review this.
Thank you.
More time. Thanks.
Committee, we are totally out of time. We had another bill to hear. My apologies to those that we weren't able to hear this. Okay, I'm sorry, we're totally out of time, so we are dismissed. We adjourn, no, we cannot. They're all waiting to come into this room.